Good morning and welcome to the 2020 ALICE report release and community conversation. My name is Dr. Keith Harris and I'm a member of the board of directors for the United Way of Frederick County, and I also serve as the executive director with Frederick County Public Schools. Today, I'm proud to represent the United Way of Frederick County Board of Directors in welcoming you to this important event. We know that our awareness and knowledge of ALICE has played such an integral role in addressing the needs of many households throughout the Frederick County community. I'd like to begin by thanking our sponsor for today's event, an important partner in supporting ALICE households, Comcast. We would not be here without their support, and we thank you. I'd also like to thank all of the sponsors for the 2020 ALICE report, and specifically acknowledge our local sponsors, the Osherman Family Foundation, Comcast, the Community Foundation of Frederick County, First Energy Foundation, FCB Bank, and the Marion P. Lee Trust, Jim Ratcheth, and Bruce Zavos. We also would like to acknowledge all of our local nonprofit, government, and business partners in working very hard every day to support ALICE households in Frederick County. I simply cannot overstate the importance of the ALICE report in guiding the board of directors of the United Way of Frederick County in our governance of our organization. And I know many of you would agree how valuable this data is and has been in informing and prioritizing our work. And so without further delay, it is my privilege and pleasure to introduce our president and CEO, Mr. Ken Oldham, to share with us the new ALICE data. Ken, is over to you.
Thank you, Keith. Really appreciate the introduction, and thank you for all of your support on the board of directors and for all of your work you do for us. As a CEO of United Way, there is just nothing as exciting as getting ready for an 11 o'clock virtual meeting, and at about 10:55, the internet goes out. So I can tell you, it was an exciting few minutes. Thank you for everybody who's bearing with us and is here on the call today. Thank you for sticking with us. I know we're starting a couple of minutes late, but we're excited to have you. The way we're going to do this, we're going to talk about ALICE data today. We're going to jump into and talk a little bit about United Way. We're going to talk a little bit about some of the findings of the ALICE and the impacts from the COVID-19. And we're going to open it up to a really cool community discussion and response. And we've got a great panel for you today. We will be taking questions throughout the presentation, and the United Way team is behind the scenes. Shayna's working the tech work. I've got a intern named Orion who's working the slides, and Malcolm is working the chat box. So if you have questions about the data, please enter it in the text in the chat box. Malcolm will be able to answer technical questions as we go along. If there's more philosophical questions, we might reserve that for the panel at the end. So we're delighted to have you. Here's what we want to accomplish today, and we look forward to hearing from you as we go through. Let's go to the next slide, Orion. So I want to speak a little bit more about United Way. So United Way fights for the health, education, and financial stability of every person in our community. Next slide, please. So we have really focused on that word, every person in our community. And we've taken a hard look at our policies and our practices to make sure that we are doing everything we can to be as diverse and equitable and inclusive as possible. We value and embrace what makes each person unique. We focus on our activity, and we try to positively affect lives of underserved populations. And if we haven't been clear, I want to be clear now, we actively oppose all forms of discrimination. And beyond that, we really work hard to affect the lives of those who are unable to afford a basic cost of living. And that's ALICE. Next slide, please. So ALICE, the asset limited, income constrained, but employed members of our community. Members of our community who are unable to afford a basic cost of living. This is who we're talking about today. Next slide, please. So ALICE is an analysis of Frederick County households who have insufficient income to offset a basic cost of living. They are families who in normal conditions have to make extremely difficult decisions on a daily basis. I want to emphasize in normal conditions. We are not in normal conditions as we sit right now. ALICE provides critical information about how financial stability is spread across Frederick County demographics. I want to be clear about this. The data we're going to be looking at today is from 2018. We are in an extremely difficult situation right now with COVID-19, but frankly, it's going to take time for that data to be refined and gathered and reported, and it's just not ready right now. Now, United Way is working on United Ways of Maryland are working on ways to advance some initial data so we can have a better feel, but it's not available right now. But here's the thing. This is 2018 data that we're looking at now, but this is the critical baseline on which we are going to be measuring COVID impacts into the future. Let me say that again. It's 2018 data, but this is the critical data on which we are going to be measuring COVID impacts against. Next slide, please. So here's what we hope to be able to answer. We want to answer what's the basic cost of living in Frederick County? How has that changed over time? How does the basic cost of living compare to the federal poverty line? And we're going to spend some time talking about federal poverty. What percentage of ALICE households qualify as ALICE? And then how are segments of the community affected differently? We're going to take a look at all of that. Next slide, please. So introducing this slide, so you're looking at right now is the United States of America. This is the whole country. And we put this in here on purpose because we want to show you that 43% of Americans are unable to afford a basic cost of living. We also put it in here so you get you can acquaint your eyes to how these charts are laid out. From this point forward, when we're looking at bar charts, poverty will be in red. The ALICE will be in that yellow-orange color, and then above that will be above the ALICE threshold. Oh, excuse me, it will be above ALICE. Now, I see the dotted red line there. That is the ALICE threshold. So when I'm talking about ALICE threshold, that is the point in which you are ALICE. And when I refer to ALICE, unless I'm speaking specifically about poverty, I am inclusive. In this case, I'm speaking about the entire 43%. So that ALICE threshold and below. Next slide, please. I want to mention that we have a lot of slides to cover, so I'm going to be moving through pretty quickly because I want to allow enough time for the panelists as well. Please enter your questions into the chat, and Malcolm and others will be working on those. So let's take a look at Frederick County as a whole. So Frederick County, what I can tell you right now is that 37% of Frederick County is unable to afford a basic cost of living. 6% of that is federal poverty line, and 31% is above the federal poverty line, but below the ALICE threshold. So adding those two together, we come out at 37% as ALICE, below the ALICE threshold. So let's take a look at that as a point in time. Go ahead to the next slide, please. So here we are looking at how this has changed between 2010 and 2016. Now remember, 2010 was immediately following the economic crash and the housing crisis of 2008 and 2009. So this gives us a pretty good comparison of where we are. So what we have seen between 2010 and 2016, excuse me, is a relatively steady increase of percentage of ALIS households in Frederick County. Now in 2018, for the first time, and I can tell you since 2008, so the first time in 10 years, we had actually seen a decrease in the ALIS in the percentage of ALIS households in Frederick County. So in the last 2 years, we went from 39% to 37%. Sadly, I'm afraid that may be wiped away entirely and probably plus some by the COVID. As I've suggested before, the data on that is still outstanding. I can only speak anecdotally. Next slide, please. So one of the questions we want to answer, go ahead and hit the space bar. Orion, please populate those. Yeah, there we go. Hit the next one too, might as well. So what is Frederick County's basic cost of living? And we can tell you right now for a single adult, according to the ALIS report, it requires about $47,000 to offset a basic cost of living in Frederick County. For a family of 2 adults, 1 infant and 1 preschooler, for the first time, the ALIS budget has superseded $100,000. Now we pull out 2 adults and 1 preschool and 1 infant because that is a good measure. We can put together an ALIS budget for just about any family size. These are the ones that we typically look at. Next slide, please. I want to talk for a minute about the federal poverty line, and this is something I know I've talked to a lot of people about before, but I continue to speak about this from an educational perspective. So the federal government assigns a federal poverty level that is the same throughout the continental United States. So in other words, that $12,000, that number you're looking at there, $12,140 for the single individual, the government would consider you in poverty in Frederick County if you make less than that and you're a single individual. Now, if you live in Manhattan, what's the Manhattan, New York? What's the federal poverty line in Manhattan, New York? Well, according to the federal government, it's still $12,140, $25,100 for that family, for that same family of 4. There is no geographic differentiation and localization of the federal poverty line. There are 2 exceptions, Hawaii and Alaska. Why those have a different federal poverty line compared to continental United States, I don't really know, but that's the reality of it. So as you can see, we do the math for you here. When we compare the federal poverty level against the ALIS survival threshold, you can see there's a $35,000 difference for the single individual, or $84,000 difference for the family of 4. Now, the federal government actually acknowledges to some degree that that $12,000 federal poverty line is off. So they assign some federal assistance programs for low-income families up to 200% of the federal poverty line, which would bring that math for that single individual up to $24,000. But even then, the difference between $24,000 and $47,000 is significant. So in other words, there are individuals in our household who are unable to afford that basic cost of living, but also are ineligible for federal assistance. And that's where United Way and the nonprofit community really has been has focused in the last few years. We want to accommodate those that are definitely in poverty and hurting, but there's also a subset of families in this community who don't get the help but need it because they're unable to pay for their bills on a monthly basis. Next slide, please. So we're looking at so there is some good news in this report. So we looked at the median household income between 2016 and 2018. We actually see a substantial increase in median household income. Frederick County is a desirable place to live. There is no doubt. We also have some added pressure from Montgomery County because there's a lot of families moving out of Montgomery County to Frederick County because it's a desirable place to live. The property values are a little bit less. It's a little easier to live here on a basic cost of living, but that it's also driving demand. So that also leads to higher costs, which is why we see such a significant increase in housing and other items in Frederick County. So unemployment at the time in 2018, it almost seems weird talking about a sub 4% unemployment level. It got as high as about 9.5% in Frederick County, maybe closer to 10. Hopefully that we've seen the worst of that, and hopefully we're on the downside of that hill and employment continues to be better. So the employment number is something that we can gather fairly quickly. Some of this other data is going to take a lot more time. So health insurance rate has been historically very, very high in the state of Maryland. There's really two things to consider here. First, this is whether or not you have insurance, and whether you may be underinsured and still be included in this. And of course, COVID with a health insurance system that aligns health insurance with employment, and we suddenly have a sudden decrease or a sudden increase in unemployment, then people are losing their health insurance. Federal poverty rate, as we said, has gone down. Now, the housing burden rate is very interesting because it's 30% of if you're a renter in this case, and you've got housing costs of more than 30% of your income, you're considered rental or housing burdened. And in this case, in 2018, about 51%. We anticipate that number will be going up in the COVID environment. Next slide, please. So we're able to look at individual communities. So ranging from Adamstown down to Emmitsburg. Not a lot of surprises here from the data we've looked at in the past. And I think if you think about it, probably not a lot of surprises overall. Urbana and Adamstown and Linganore tend to be the fewest percentage of Alice households. And we go all the way down to Emmitsburg, City of Frederick, Thurmont, and Brunswick, which have the highest percentages of Alice households, but it's worth always spending a little more time on the City of Frederick, since there are so many households in the City of Frederick, yet 50% of them are unable to afford a basic cost of living. Next slide, please. So when we're talking about this, it's important to keep perspective. And what this chart shows is the number of households outside of the city and the number of households inside of the city, and then the percentages of Alice households within those communities. So roughly 1/3 of the community lives of the county lives in the City of Frederick. And you can see that 11% in poverty is roughly the same as 4% of the rest of the community, because the rest of the county. But we were surprised to see this analysis because it really shows you, gives you a good idea of just how many households are in the City of Frederick compared to the county, and how many are Alice at the Alice threshold or below. Next slide, please. So now we're going to start getting into individual demographics. First thing we're going to look at is age. So the bookends are the pieces I'm going to be speaking about mostly today. So under 25 years old, so a very high level of the Alice threshold or below, or Alice households, about 83% of households. Couple of notes here. These are what is called technically emancipated households. This is not Johnny living in mom's basement. These are on their own adults and attempting to live independently. 83%. Now, I have to say this is that there are relatively few Alice households, independent Alice households under 25, roughly around 2,000 of them. which means that so 2,000 is your denominator, your numerator. Any changes in the numerator has significant difference. There's makes a significant difference on the percentages. So we see a lot of swings in under 25, almost to the point where it's almost not enough data to make a quantified analysis. Over 65 is quite the opposite. We have a lot of over 65 households, of which 47% are unable to afford a basic cost of living. This is concerning in two ways. First, the percentage is going up on an annual basis, and the numbers of seniors of seniors in our community is also growing, which means that we've got a two-ended problem here: numbers growing, and the number of those growing who are unable to afford a basic cost of living is also growing. Next slide, please. So here continues to be an area of focus at United Way, and I know many nonprofits throughout the community. You're looking at 79% of single mothers are unable to afford a basic cost of living. And I'm not suggesting or minimizing the plight of single fathers by any way. As a matter of fact, I would say that single fathers are an even more difficult demographic to reach out to, because they are much less likely to ask for help. What we see in single mothers, while there's a substantial portion of our community single mothers aren't able to afford a basic cost of living, our experiences at United Way is that many of them are asking for help. We have a lot of work to do, but we're happy to see that those households are asking. Next slide, please. So in an era where we're talking about a lot about diversity, equity, and inclusion, and the social unrest is going on, we really are taking a careful look at this data for race and ethnicity. And there are a couple of observations here. First of all, again, when we have seen this in the past compared to prior years, the percentage of Caucasians is staying relatively flat. And similarly with Asians. What we are seeing, though, is a growth in the Hispanic population, but we're also seeing a growth of Hispanic populations who are unable to afford a basic cost of living. I want to be really the interesting part of this data is that, especially when we're speaking about the Hispanic population, is that 51% are unable to afford a basic cost of living. In other words, they're out of poverty, but they're below the ALICE threshold, which tells us that they're working. Is that they were out there working. COVID has had a dramatic impact on communities of colors, but at the time of this data, these individuals are covered. They have a poverty line, which is similar to that of Asians and Caucasians. Now, when we're looking at the African American community, we have a bit of a different picture. We see a larger percentage in poverty and a smaller percentage who are above poverty but below on the basic cost of living. This should be informing us as a nonprofit community and as a public sector, and even as members of this community, about the work we have to do in diversity, equity, and economic inclusion, especially. Frederick County is not immune. Next slide, please. This is a slide that we've entered recently. So this actually compares the raw number of Caucasian households versus those of communities of color. And this is valuable information when we're talking about diversity, equity, and inclusion, and how we kind of focus our programming as a United Way in the nonprofit sector on these communities. This graphical analysis has really opened our eyes about the needs and needs in our community, where 35% of Caucasians are unable to afford a basic cost of living, but that represents a significant, just over 25,000 households. Next slide, please. So we've looked at the data, but data doesn't always do a great job of telling you who we're talking about. So let me take a few seconds here to talk about that. Alice, they're people that we see every day. They are our retail clerks and stock pickers, our restaurant waiters and kitchen staff and cooks. They are nurses at our medical and assisted care facilities. They are our hotel staff. There are many others who are Alice in our community. I picked these out because these are also direct correlation with the industries and workers who have been most affected by the COVID-19 pandemic. I'll go through that list again: retail clerks and stock pickers, restaurant staff, nurses, assisted care facilities, hotel staff. These are either workers that have suffered reduction in hours or outright furloughs or layoffs, but they are also individuals that when going back to work have faced health exposure to COVID-19 and other sicknesses. Next slide, please. So let's talk a little bit about COVID-19 analysis. And I want to be very clear about this, that again, the data is still out there. So what I'm speaking about now is really anecdotal at best. Next slide, please. So what you're seeing here is a list of consequences that have adversely affected Alice households. Certainly health, exposure to the actual virus itself. Many of our Alice households are working in environments that increase their exposure. Unemployment, we see this all the time. Alice households are the most likely to have been laid off, furloughed, or reduced in hours. Food insecurity, housing, childcare, and transportation are all issues that have affected our Alice households significantly. I would throw in there education and access to broadband as well. Next slide, please. So I want to speak a few minutes about United Way's response. So United Way, as soon as the pandemic hit in March 2020, United Way jumped on, we sprang to action and did the best we could to raise as much money as we could to support Alice households. We're delighted that we raised over $300,000 from over 700 contributors and supported over 50 nonprofits. And we couldn't be more thankful for the support of the funding community, Osherman Family Foundation, Community Foundation, Delaplane, Serenity, and Women's Giving Circle, among others, who worked with us to help develop this campaign and raise money and coordinate our funding efforts. This group of funders distributed over $1.8 million in funding to the nonprofit community. United Way played a part in that, but it was a collaborative between these funding organizations, and we couldn't be more thankful for the partnership with them and with you, the community members in our community who contributed so generously to the campaign. Next slide, please. So United Way's response is really focused on, among other things, on our Prosperity Center. For years now, we have focused on a Prosperity Center, and this has been an opportunity for us to look at the Prosperity Center more carefully and position it for COVID response specifically. So we are now introducing what we're calling pathways to financial stability. There are two primary pathways. One is a pathway to home ownership, which is credit counseling, budget coaching, income tax assistance, and a match savings to purchase a home. A home, we are convinced that a home is a life-changing activity, and we're delighted to be able to provide this. We also have a more recently introduced pathway to transportation, which is the same pathway with the exception that we offer a match savings to purchase a car. We know that transportation is a major issue in our community. Next slide, please. And finally, you will be hearing more about United Way's ongoing response and our United in Recovery campaign that is going to, again, focus on bringing relief and support to Alice households in the coming months and perhaps even years as well. Next slide, please. All right, so that concludes the formal portion of our program. I'd now like to switch over to our panel, and I couldn't be more delighted with the panel we have today to join us today. I want to say this, that the panel has agreed to, our formal program lasts about an hour, but the panel has agreed to stay on a little bit longer should there be questions that still need to be answered at the end of the time frame. So as we just heard in the ALICE data, ALICE are those who in normal conditions struggle to afford basic necessities. The COVID pandemic has placed even more pressure on ALICE to sustain themselves and their families. Today's panel was put together to provide unique perspective on struggles of ALICE in Frederick County. But first, let's meet the panel. First, I would like to introduce Daryl Boffman. Daryl is the Executive Director of Public Affairs for Frederick County Public Schools. He was the president and CEO and founder of Acela Technologies, an information technology company headquartered in Frederick. In addition to his success as a business executive, Daryl serves as a board member of Frederick County's Chamber of Commerce. He served as a member of Frederick County's Board of Education from July 2000 to November 2010, and has served as a board member for Hartley House and EAG, which is Eliminating Achievement Gaps, as well as the Board of Associates for UNESCO Center for World Peace and Hood College. Daryl was recently selected to serve as a board member for Frederick Health. Daryl, it's delightful to have you here today.
Ken, it's a pleasure to be a part of this worthy cause. So thank you for the invitation.
Thank you, Daryl. Next, I'd like to introduce Josh Bokey, Director of Government and Regulatory Affairs at Comcast. Josh has been with Comcast for the past 13 years, working within Metro Washington, Northern Virginia, and suburban Maryland area, including Frederick. During his time with Comcast, Josh has been an active champion of Comcast efforts to help close the digital divide, including both promoting and helping to create partnerships on Internet Essentials, the nation's largest community investment program to help bring affordable, high-speed internet access to families and individuals in need. Josh and his family live locally in the city of Frederick. Josh is also a prior member of the Board of Directors of United Way of Frederick County. Thank you, Josh. Mental Health Association, as well as past chair of the Frederick Chamber of Commerce. Thank you, Josh, for joining us again and for Comcast sponsoring today's event.
Pleasure, Ken. Thank you.
Yeah, you're welcome. I'm very excited to introduce Ramenta Cottrell at one of her first public speaking events of what is her second week on the job. Ramenta joined the city of Frederick as the new Director of Housing and Human Services on October 5th, after working for Goodwill Industries of Monocacy Valley since 2013, with a background in providing programs to various populations, including vocational training, youth development, and services to adults with disabilities. She has had the opportunity to work with various human services and nonprofit organizations to build effective collaboration centered around affordable housing, competitive employment, transportation, and effective mental health services. Thank you, Ramenta, for joining us, and congratulations on your new gig.
Thank you for having me. Hello, everyone.
Delightful to have you. Last, but certainly not least, I'd like to introduce Maria Herrera. Maria is the Executive Director of Spanish-Speaking Community of Maryland. She oversees the organization's wide range of offerings such as victims of abuse, support, nutrition, healthcare, education, housing, employment, and immigration services for low-income families. Maria is a member of the DBE Committee for the City of Frederick, the Committee Against Hate and Violence for Montgomery County, which she also chaired its legislative subcommittee, Prince George's County Human Trafficking Task Force, Latino Liaison Committee, Trauma Responsive Frederick, and HOA. She also served on the DC Women's Council for Make-A-Wish Foundation and other impactful committees. Thank you for joining us, Maria. Oh, Maria, you might need to unmute there. All right, we'll come back to Maria. Thank Maria for being here. So we put this committee together to really provide that diverse perspective on what our Alice families are facing every day. Ramenta, I wanted to start with you. You've taken a new role with the city of Frederick, but you have years of experience with Goodwill in Frederick County. What new or expanded challenges do you see facing Alice families during the COVID-19 pandemic?
Sure. Definitely, this pandemic has been a setback for everyone. Despite your socioeconomic status, it's been a setback for us all. But I think for the families that we define as Alice families, one thing that I've noticed is the trauma has, instances of trauma are definitely escalating. If you think about all the issues that existed before, now you have children or spouses that were in homes that experienced a lot of trauma to begin with, but now with the pandemic and with the shutdown, people have been in their homes experiencing even more and not really having that outlet to escape, whether they're going to work or going to school. The other thing is looking at healthcare. As we know, healthcare for Alice families has always been a challenge, just the affordability of it or access to that. And unlike our president, most of our families don't have this amazing healthcare where COVID is literally scary and it can mean death for many people. And I think just looking at what's coming out of COVID, coming out of the pandemic, how many people have escalated healthcare issues is something that we're going to have to pay attention to. Employment is always the defining factor for many people, whether it's employment or just the ability to have access to more financial resources. For many of our families that are working, that are defined as Alice families, employment has been a barrier, whether it was due to being furloughed, being downsized. A lot of companies now, due to pandemic, as they have furloughed their employees, looking at efficiencies. They're looking at, maybe we're not bringing all of our employees back. So the positions that are going are the ones that were more lower paid, and the people that are having opportunities or less opportunities to find more competitive employment, they are definitely having more of that now. And just the fear of calling out of work. As we know, many of the people that we support, if they don't have access to good health care or they don't have the cushion of having money in the bank, calling out is really scary for a lot of our families. And so those who have had to call out have experienced an immediate financial setback, or those who decided that, you know what, I may have had exposure, but it really is important for my family for me to go to work. We can assume that they have exposed more people who are probably defined as Alice families as well. And the last thing I would say would be childcare. I know we all love our children, but for a lot of families who have been home for the last 6 months with their children, I'm sure it's been very stressful for a lot. If you start to add to that equation children that are school age, there are many parents who already struggle with technology themselves, and now they're trying to support their students as they're working with that. There are a lot of families that are at home trying to learn to be teachers, especially those who have multiple children who are in different grades. That has been an extreme challenge. And then not having access to different childcare options or even extra tutoring for their youth. If we look at our Alice households versus more wealthy households where they're able to bring in more instruction, there's a great divide. And so when we're coming out of this, our children for the last year, they have definitely had a setback in their education as compared to some families who had more resources to get what they needed for their children.
Thank you, Ramenta. Thank you very, very much. I want to move to Maria. Maria, you work almost exclusively in the Hispanic community. And as the Alice data showed, the Hispanic community has a similar percentage of households who are in poverty as their Asian and Caucasian counterparts, but a larger percentage above poverty but below the Alice threshold. Provided that this is pre-COVID data, how has the population been affected by this?
Can you hear me, Ken?
Yes, we can, Maria. Great to hear you.
Great to hear you as well. My apologies. For some reason, my video is not working very well.
Maria, we are getting a little bit of an echo. So if you have two devices going, just make sure one of them is muted.
Okay, is that better?
I think so.
Okay, thank you so much. So my apologies, my video for some reason is not functioning properly. First of all, thanks so much, Ken, for allowing me the opportunity to be part of this dynamic panel. First, wanted to mention that the vast majority of our clients are the international and Hispanic single moms, as well as the families that fall under the poverty level or ALICE. To answer your question, the Hispanic families have been significantly impacted by the COVID-19 pandemic, as they are individuals who work in restaurants, cleaning at hotels or houses, landscaping, or construction. As we know, these are the jobs that have been mostly impacted by the pandemic since March. Also, individuals who lack medical insurance. Some have never visited a dentist or a doctor in the US, including their children. Many who do not accrue sick leave, vacation, or any other types of benefits due to their job positions. Many work minimum wage or are paid below minimum wage. Some are eligible to receive unemployment and stimulus checks, and some are not. Some are too fearful to ask for unemployment checks because they believe that this could impact them if there was an immigration reform. Another major concern also of this population is those who are currently holding work authorization permits, say TPSs. They are in jeopardy of losing their work permits in January of 2021. And these groups of individuals, according to the National Immigration Forum, include about 248,000 Salvadorians, 79,000 Hondurans, and about 55 Haitians nationally. There are about 47,000 that live in the DMV area. Specifically, about 23 of those live in Maryland. 22 of those have US-born children, which are about 273 children, and have also brought children here to the United States. 11% of those individuals are self-employed and have created jobs for others. Also own homes and hold other types of positions in healthcare, schools, and management. On September 20th, 2020, the Ninth Court of Appeals ruled in favor of ending the TPS program. It will probably end up in the Supreme Court for a final verdict. Litigation is going on, and we expect an announcement in about 2 months. So if we can think about this population as well, we can easily understand what the further impact could be, never mind what's going on with the epidemic right now. The impact of the pandemic, individuals are behind in rent payments. They're behind 2 and 5 months. They have started to receive some court orders for lack of payment. SSCM is working with them and the Religious Coalition to provide some rent relief. Also, another concern is the sub-landlords are threatening to put them out. There are a lot of multi-families living in 2-bedroom apartments or basements. This I expressed to you some concern that I had expressed to you before, Ken, regarding the ALICE report and the poverty level of ALICE. I believe that this number is higher due to the unaccounted multifamily situations that we face. Some are back to work with reduced hours, 5 to 10 hours a week. They're behind on utilities, gas and water bills. Some qualify for energy assistance, others do not. They're borrowing money from friends to be able to survive, and debt continues to grow. They're suffering depression and desperation, lack of mental assistance because they're uninsured. We have seen increase in alcohol consumption and acts of violence. And kids, now their family are saying, are experiencing attendance issues or dropping out of school to work in order to help their moms during the pandemic. So with all this said, more concerns are coming for the winter months that we know because of where this population works. A Fox survey indicated that 60% of people have said that they will not go inside restaurants during the winter. If this in fact is the case, more layoffs will be coming and or business closures that are already facing hardship. Having said this, no one knows where this pandemic is headed in the coming months, but I do foresee additional challenges that will only move more families to the ALICE and poverty levels as we continue to weather this economic and emotional storm.
Thank you, Maria. Thank you really for putting it in a national perspective as well. Really appreciate your support in this area. Daryl, You and others have observed that the cost of technology may not be sufficient to support a family's broadband needs at home school learning during the COVID-19 pandemic. How are families coping, or perhaps they're not?
Well, Ken, as a part of my past life, I dealt a lot with technology, and in particular with cellular coverage. And I can tell you that even back in 2013, at that point, society had reached a point where technology was no longer a luxury, but a necessity. And in 2019, over 96% of US adults own a cellular or a smartphone. And for many, that smartphone is their primary means for accessing the internet. For some families with low income, their cell phones and internet bills are a higher priority than their other utility bills. You can understand why. As you know, these smart devices replace the home phone, the camera, the video cameras, the gaming systems, the radio, cable TV, and many other functions. With that said, smartphones are not ideal for accessing schoolwork and completing assignments. FCPS understands that challenge, and as a result, we had an initiative to provide assistance with internet services and technology for our students. The technology piece was addressed via the distribution of Chromebooks to every student. Initially, it was only issued to high school and middle school students, but we extended it to include also all the elementary school students, because in this virtual learning model, they all had to have access to the internet to connect with their teachers in their classrooms. In addition, we either provided hotspots through arrangements we have with a couple of carriers so that the families can have internet services in their home, because having a Chromebook without internet services was not going to resolve the issue. So we distributed hotspots free of charge to some families to make sure they had internet services. And then for other families, if they qualify for Comcast Internet Essentials, we provided information to those families to reach out to Comcast to acquire the Internet Essential services. With all of that, there is still a small group of students without internet services because the internet service providers have not extended services to some communities in Frederick County. Perfect example is up in Thurmont. There are some places where they just don't have internet services, period. And I believe the city and the county are looking at those issues to address from that standpoint. With all of that said, it appears that families are coping fairly well. We have experienced a pretty high level of virtual learning participation from our students to this point. Haven't had a lot of challenges with getting them to sign on to their classes and participate in virtual learning. So as with most other situations, our families are finding a way to cope. And Frederick County Public Schools is trying to assist with that process. And again, we know that Josh Bokey is on the call as well, but we're very thankful for Comcast and their Internet Essentials program.
Well, needed to remember to unmute myself. Great segue, Daryl. Thank you so much. And turning to Josh Bokey. Josh, you're an employee at Comcast. Comcast has expanded the accessibility of Internet Essentials to help meet the needs of Alice families. What changes has Comcast made to Internet Essentials to make it accessible to a wider community of Alice households?
Well, first, thank you, Ken, and really to the entire United Way team and board for having me here this morning to participate. First, I'd like to take a moment to set the table about what Internet Essentials is, and then I'll go ahead and share some of the enhancements and partnership opportunities that exist today. Ken and Daryl, I think as you both presented, one of the needs, right, of Alice families concerns being connected to the internet or via cell. And I think we have to recognize along with that, right, is that there's no one size fits all solution, and certainly no single technology solution when it comes to addressing digital equity and access. However, I will say that here at Comcast, we have been at the forefront of helping to bridge the digital divide for many years now. And one of the tools we utilize, as was mentioned, is Internet Essentials. Internet Essentials is the nation's largest community investment program. It's designed specifically to bring affordable, high-speed internet access to those families and individuals who do not have it today. So with Internet Essentials, a family or individual in need receives a high-speed broadband connection, and which is able to handle multiple video calls at a time. Internet Essentials is at $9.95 per month, and there's no contract attached to it. Participants are also eligible to purchase a refurbished computer for $149. And we've expanded who is eligible to participate to include families and individuals who may be receiving any type of federal, state, or low-income assistance. So this may include the National School Lunch Program, low-income veterans who are on assistance, low-income seniors, and families and individuals who live in HUD-supported housing. All are potentially eligible as long as they have not had Comcast internet service within the past 90 days. I will say that back in March, almost everyone's world changed abruptly, as we've discussed here. And folks who would not usually go online suddenly had to. But I'll say, though, that we responded as well, including taking a look at Internet Essentials and how we could further streamline access to the program. And so that's included, for instance, that every new family individual who signs up for Internet Essentials through the end of the year will receive their first 60 days of service as courtesy. And any type of prior Comcast bad debt that the family individual may have, so for instance, an unpaid bill or perhaps unreturned equipment, is no longer a barrier as well. However, we also introduced a unique partnership program called IEPP, or Internet Essentials Partnership Program. IEPP is really designed for third-party organizations. So think of school systems, workforce agencies, nonprofits, and foundations who are able to then sponsor Internet Essentials enrollees for when that $9.95 subsidy may still be a barrier. And we recognize that sometimes it might be. And I will close with saying that we've seen a lot of great participation in this partnership program. It's included Prince George's County School System, Washington, D.C., Howard County Public School System, Carroll County. It really offers an opportunity to create a true partnership to help bring internet access to those families who need it today. And with that, Ken, I'll turn it back over to you.
Thank you, Josh. Really appreciate it. I'm actually going to turn it right back to you. So I've got you're up on my next question. What role does this is a more general question for you, Josh. What role does corporate America have in investing in underserved families and local communities?
Well, Ken, I think we all play an important role when it comes to investing in underserved communities. And I think that applies whether that's the private sector, whether that's corporate, large companies, or the small business sector, whether that's the government sector, the nonprofits, and really, frankly, all of us as members of the community. And I think, this is especially true when it comes to the issue of digital equity. And if I may, let me just touch upon that briefly. Meeting the digital equity disparity that exists today is frankly very complex. The roots of the issue, right, are wide ranging. So, for example, Daryl had mentioned this in his presentation, right? Sometimes what drives digital disparities in rural areas can be very different from what suburban and urban areas may be experiencing, right? In low density areas, that need for access really centers around the economics of the last mile challenge, right? Or bringing broadband service to rural communities. While in our urban and suburban neighborhoods, the issues of affordability and engagement are the primary barriers towards achieving digital equity. When I refer to engagement, I mean that, when the internet connection may not be the barrier, right? But for instance, that student, for instance, may still face a host of other challenges, such as caring for their siblings during the day while their parents still work, or perhaps they lack the hardware, or perhaps the parents themselves are unfamiliar with how the technology works for career searches or school homework assistance. So I mentioned all this, right, because to your point, to your question, it is complex, but it's because of this complexity that the partnerships are so critically important. And no one sector of our community in this instance is going to be able to solve digital equity alone. It's going to require all of us working together in concert if we're going to make meaningful strides. And so I'll just close on this, that, for instance, I will say with our program of Internet Essentials, we've seen now over 8 million people who are now connected to the internet who otherwise wouldn't be. And we're seeing creative partnerships, right, all over the country, including this region and right here in Frederick County. And that's why I'll say, Ken, that I appreciate today's presentation, because I think that, the ALICE report updates are so critically important because it does help to guide, I think, everyone's efforts in terms of giving and everyone's efforts in terms of where to focus next on how to best help underserved populations. So thank you for the leadership of United Way here today and throughout the year.
Thank you, Josh. I want to call your attention to the chat box. As I move over to Daryl for the next question, there was a question there about receiving more information about Internet Essentials. So you might want to put something in the chat box while we move over to Daryl. Daryl, next question's for you. So what resources does the school system need to better support ALICE students to reduce the achievement gap? I realize that's a big question.
It is a big question, but Ken, it's a very important question. And I will start by saying the best way to reduce the achievement gap is to focus on eliminating opportunity gaps. And I say that because the achievement gap, it tends to draw attention to the individual students and their educational performance, basically putting the onus on the students to achieve. Whereas the opportunity gaps draw attention to the conditions and the obstacles in place that impacts the student's ability to achieve academically. And sort of to answer the question, the school system needs funding to support programs that eliminate opportunity gaps. We need to fund initiatives like all-day pre-kindergarten for families with low income. Because students from families that fall within the poverty or the ALICE income levels, they start school with achievement gaps. Because in some cases, their parents or guardians are unable to pay for early education intervention. And so these kids are arriving on the doorsteps with students who have had that early intervention, and so there's already a gap. That opportunity gap continues as society has grouped low-income minorities, low-income families, minorities, and Spanish-speaking families in certain segments of the community. And as a result of that, they are grouped in school attendance areas. So the schools with a higher population of students of poverty or ALICE status should receive funding that supports the specialized programs needed. In addition, these students should have access to rigorous instruction, because as you can imagine, if you're only receiving access to a lower level of instruction, but expected to perform on tests that have more rigorous requirements, you can't expect the students to excel in that area. So they need to have access to more rigorous instruction. The other thing I want to say is equity should be the foundation for decision-making, not equal. Decisions based on equality will widen opportunity gaps and thereby widening achievement gaps. Now, I have seen improvements in Frederick County Public Schools. However, there is still a way to go to eliminating opportunity and achievement gaps. So I hope that answers your question.
Thank you, Daryl. That certainly did. Thank you very much. Maria, I want to turn to you. How do we support working immigrant households so they can emerge from COVID-19 perhaps stronger?
Okay, so.
Oh, Maria, we are getting big echo. You may have
Can you see me now? Okay, there we go. That works. So first of all, what I would suggest, can you guys hear me echoing?
Yeah, so you may have two devices up. One needs to be muted.
Okay, let's see here.
So unfortunately, I'm going to go with this one. Can you hear me?
Much better. Thank you.
Okay, sure. So we can support and strengthen working immigrants' households through, I believe, training and education. creating better opportunities to have the Alice needle upward, affordable home ownership, employment opportunities and resources, nutrition, medical options. For example, the United Way and us, SCCM, are organizations as well as others that strive for self-sufficiency and can assist families accomplish these goals. Teach how the dollar can be stretched further, financial literacy, how to save and invest, set achievable goals, and all these will help empower families to move forward. Invoke a supportive mechanism and communication channels for the dissemination of information to the community. Collaborative efforts, all hands on deck to help the families. Legislation, advocating for heftier penalties for abusive employers who take advantage of the necessity of many and create their own rules because they can. In other words, zero tolerance for abuse. Fair compensation for all, providing guidance on labor laws and standards regardless of status. Labor laws do apply to everyone. Removing barriers, creating a culture of inclusiveness. If anyone has a skill, dare to be different. Teach your neighbor, coworker, family member, friend, or a student that skill. There's no better feeling than to make a difference in someone's life. Yes, you do have time if you want to allow it. Finally, embrace and treasure diversity for a unified Frederick. I will end with this. According to American Community Survey that was conducted by Homestack.net, there are 6.3 million more Hispanics living in the U.S. since 2010. 37% increase in Maryland. Cities in Maryland with the highest Hispanic population, Frederick ranks 9th out of 10. Thank you again, Ken, for allowing me to participate in this wonderful panel. I've really enjoyed it and hope that we will all work together to move people way beyond Alice.
Thank you so much for participating, Maria. We really appreciate all the work you do in the community. Last question goes to Ramenta. What role does the nonprofit community play in COVID-19 recovery for Alice households?
I think Maria said it best when she just said, all hands on deck, we need collaboration. I think in this time, there's just so much divide, so much negativity. You know, we're looking at the existing issues that were here already, which were affordability of healthcare, competitive employment opportunity, housing. Those issues still exist, but we have more. And I think that in a time when there's so much division, it is an opportunity for nonprofit leaders to really come together and figure out how we could streamline more resources, work together, and really, as much as we possibly can, let's try to get ahead of some of this. We obviously can't stop the pandemic, but we are anticipating a spike in the fall. And so as much as we can prepare, we're not as blindsided as we were earlier this year when it happened. So just really coming together and figuring out as much as possible how we can get ahead of some things. On top of that, I want to say that it's really easy for us to forget sometimes that many of our employees are also part of Alice households. And that means that on a regular day, they're fighting for the same resources, they're having the same barriers. And if you look at 2020, we are all exhausted by what's happening in our world. And we are expecting our employees to come to work, to be positive, and to be a source of inspiration for the people that we're serving. But you know, they're experiencing the same issues at home, and now they're coming to work and they're expected to deal with the same issues with the people that we serve. And I think it's beneficial for us to acknowledge that they have their barriers as well, and to figure out how we can keep them motivated and positive, but also how do we make sure that we're able to bring them resources as well. And lastly, I would say for the nonprofit leaders, I think we are responsible for educating and encouraging the masses. There are many people during this pandemic who have experienced it the opposite of a lot of our Alice families. There are many people that for the last 6 months have worked from home and have had the resources to bring extra care in for their children. You know, we have Amazon orders coming every day, we're getting our food delivered, and it's really easy for some people to be able to turn off the TV and not really understand the impact that this pandemic and other things are happening on the world. And I think that part of our responsibility in creating change is making sure that we're educating people. And so we're not just educating our employees through training and development. We're also trying to empower the people that we're serving to be self-advocates and to be ambassadors for themselves. And we're trying to teach our volunteers that we have about the real issues. And so just being in a position where we're not afraid to educate and challenge and really let people understand how this is impacting the people that they may not have an opportunity to have access to on a regular basis.
Thank you so much, Ramenta. I'd like to conclude our session in a couple of ways. First off, I think it's worth mentioning how we have seen the Alice report being used in the community. It has been incredibly good comparative data with the Alice report comes out every other year. So it gives us an opportunity to compare year on year what is going on in our community for critical decision making. And I think at no more important time will this be than in 2 years from now when we release the 2022 report based on 2020 data, where we can begin to see some of the dramatic, what we anticipate to be dramatic impacts of COVID-19. From the nonprofit community, the nonprofits are using this report often, if for no other way, that they are using it in the justification and positioning of their programs with their funders. Nonprofits are dependent on funding to continue to do what they do, and we see it time and time again. Nonprofits are using this data to position their programs for success. Key decision-making, community-wide. We see our governments thinking about Alice as a unit and using the data to help position their policies. We have seen nonprofit organizations and others that are positioning their qualification criteria using Alice numbers. Number of nonprofits have tried for years using some variation of the federal poverty line to mixed success, enter Alice data, and all of a sudden they have a way to keep up with the cost of living and the struggles of Alice households. And definitely, last but definitely not least, informed wage setting. We have heard from company after company, whether nonprofit, for-profit, or even government, come to us and say, we have used the Alice report because it let us know why our employees are living so far away, or why absenteeism is so high, or why our employees appear to be stressed. The informed wage setting is a critical use of this. With that, I want to thank everybody who joined us on the call today. I really want to thank our sponsor, Comcast, for making this program possible. Our panelists, Josh Boki, Daryl Boffman, Maria Herrera, and Ramenta Cottrell, thank you so much for joining us today and sharing your expertise and opinions with us. I want to thank my board of directors at United Way of Frederick County. They don't receive enough credit for taking the risk now 6 years ago to say, okay, we need to invest in the Alice project. I couldn't be more happy with them and with the group and the leadership that they are showing our community. Thank you. And finally, I want to thank my staff. They are all behind the scenes right now doing things that you're not seeing, but they're working really hard to make this program and other programs possible. And I'm so deeply appreciative. At this point, we'll conclude the program. Thank you very much. Feel free to reach out to us if you have additional questions about the Alice report. We are available to present to employees, to board of directors, to community groups. This is not United Way data. This is data available to the community and for the community. Feel free to reach out to us. We are available and willing to come speak with your leadership and constituents. We
And
wish
we
you
did have some questions come in. Do we have time for any questions, Ken?
Malcolm, I'm afraid we don't have time for questions.
Okay. Got it.
Thank you very much, everybody, and we sincerely appreciate your time this afternoon, now this afternoon, and thank you especially for bearing with us as we had that short delay at the beginning of the program. Thank you so much.
Thank you.